Friends, I'm Dr. A.S.K. Gupta and I'm going to demonstrate to you a case of pregnancy in the rudimentary horn. You can see that there's a pregnancy which is a pregnancy around 20 weeks of gestation, and if I tilt my probe towards the right flank of the patient, I see that there is another sac in which there is an amorphous fetus-like mass which is probably a demised fetus. It does not take up any color, and this is the pregnancy in the rudimentary horn of the uterus. Corresponds to nearly. When I try to put the color into this pregnancy or the sac, I find that there is no color uptake. It means that this is an amorphous tissue, or the fetal demise has already occurred at the level of 12 weeks of gestation. What are the possible diagnoses in this? When I take my probe transversely from the pubic symphysis upwards, I find that there is a rudimentary horn on the right hand side, and there is a horn, another horn, which is carrying the live pregnancy. Other possible differential diagnosis could be a twin pregnancy in the same horn of the uterus, but there is a tissue over here which appears to be uterine wall. It does not appear to be the amniotic band or the amniotic membrane which is dividing the two sacs, and there is no separate placenta over here. So probably this is a pregnancy in the rudimentary horn of the uterus. I find that there are iliac vessels just below this rudimentary horn. So this could be either an extra uterine pregnancy in some tissue of the abdomen, or this could be a rudimentary horn. You can see here that the blood vessels can be seen in the uterine tissue intervening between the two horns of the uterus. Here you can see the uterine artery originating from the internal iliac artery and supplying the part of the uterus which is divided into the two horns. From the iliac vessels we can see that the uterine artery is originating, and it is supplying the rudimentary horn as well as the main horn of the uterus. This is the color flow pattern and the power Doppler scan of the iliac vessels, and it signifies that this is the internal iliac artery. When we try to look for the other anomalies in the fetus, we found that there is a echogenic cardiac focus in the left ventricle, and when we try to see it in the normal without the tissue harmonic imaging, we find that the tissue harmonic imaging of the echogenic cardiac focus is visible, and this signifies that this is a significant echogenic intracardiac focus. This is the rudimentary horn, and you can see that the on color Doppler, it is taking the normal tissue of the uterus is taking up the color, and there are vessels traversing through this tissue, and this is the uterine artery, and this is the cervix in which the uterine vessels can be seen. So it is quite possible that we are dealing with the rudimentary horn of the uterus and not the extrauterine tissue. And this is the urinary bladder you can see, and this is the uterine artery which is visible. And once we trace it upwards, we find that it goes up to the level of normal uterine horn and the rudimentary uterine horn. And probably so we feel that we are dealing with a case of a fetal demise in the rudimentary horn of uterus and the normal pregnancy in the normal horn of uterus, which is the well-developed horn. I hope we have been able to demonstrate a good case, and in case you like this video, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of our friends. It is possible that the fetal demise occurred early in the pregnancy because of the compromised supplies of or because the rudimentary horn could not grow as per the requirement of the fetus. In case you like our video, please do subscribe to our channel and share the video among large number of our friends so that maximum people can benefit it. Thank you very much.